We hope you don't have cancer, but if you do, this show's for you. The Stupid Cancer Show!
Hey guys, welcome back to another exciting episode of the Stupid Cancer Show. I'm joined here today by my friend Marcie Reeder, the Executive Director of the National Comprehensive Cancer Networks Foundation, the NCCN Foundation.
Thanks for having me.
Thank you. Welcome. You enjoyed the scenery. Very excited to have you on the show. I've been a huge fan of the organization for a long time, and I'll tell the crowd, this is like the Secret Santa ninja sleuth group you've never heard of that's doing all this incredible work behind the scenes that you need to know about. So we're going to dive into that and more right now. So what is NCCN?
NCCN is the National Comprehensive Cancer Network. We've been around for over 20 years, and it's an alliance of the big academic cancer centers across the country, ones that are very notable that you hear about often, like MD Anderson, Memorial Sloan Kettering, Johns Hopkins, Mayo Clinic, City of Hope. Those are the types of institutions that are part of NCCN. And the main product that NCCN develops are a series of something called clinical practice guidelines. What is that? Those are guidelines that are developed by the top subspecialists in cancer in each of these member institutions. They get together and they talk about what is the science right now, what is the best way for us to treat patients, and every patient's individual, so it's not one size fits all. So what are all of the different types of treatments and care for patients that we should be recommending as the best care for patients?
So like a baseline of common ground to start from, but specific to certain disease markets.
Absolutely. There are so many different types of cancer, as we know, and it's complex. And lucky for us, there is a lot of movement in terms of new discoveries, new treatments, and how do you keep up with as an oncology professional, somebody's treating cancer patients? How do you keep up with the new, the best,
Right.
How should I treat this patient? So NCCN's experts from our member institutions volunteer their time to come together on many, many, many different panels, focusing on many different cancer types and cancer topics. And they come together in consensus on what type of treatment is best for patients. Then they put these recommendations into an information source that can be accessed by anybody, actually. It's free, and clinicians use it all over the world.
Right, so the goal is that there will be almost like mimicry. People will look to these things as like the Rosetta Stone, in a sense, of how to start with this particular patient.
Absolutely.
Like a universality.
Yes, and when medical professionals are learning their trade through school, which is great, but you graduate and you move into practice, things change quickly. And if you're focused in a certain cancer, then great, you're going to keep updated on that type of cancer. But since so many patients are seen at the community level, where physicians and care teams see all different types of cancer,
Right.
It's almost impossible to stay updated as to every single type of cancer.
Yeah, how can you know everything?
There's no way.
Right.
And it's a full-time job. It would be a full-time job just to keep up with the daily changes that happen to the current gold standard of care.
But it's not just necessary. This is the part that's really intriguing. There are several parts to being what comprehensive care really means.
Yes.
Part of it obviously is what the recommended dosages and pipeline products and genetic testing could be, but it's also about the humanity of the experience. It
Absolutely.
looks to supporting some of your mental health issues and your quality of life issues and your navigation issues. That is really the part that gets lost. It's not just about the research per se, it's about helping the human being get through the process by the doctor understanding that level of almost empathy.
Yeah, cancer's complex.
Yes.
And it's not just treatment. It's not just, how are we going to treat this specific cancer? It's how are we going to treat this individual?
Right.
there are age concerns, there are side effects, there are screening guidelines, there are follow-up guidelines. There's a whole host of things that have to be described so that care teams know how to best treat patients. So these physicians, these subspecialists, multidisciplinary specialists coming together and coming up with these critical guidelines, recommendations for physicians all over the world. It sets the standard of care.
Right.
And so...
But a true collaborative intent.
Absolutely.
Yes.
Absolutely. This isn't just one physician. These are the top minds from 27 member institutions coming together from all different areas of oncology, of cancer care, and deciding, this is how patients should be treated in the best way possible.
So what keeps you guys awake at night?
Oh, lots of questions there. We want to make sure that patients have access to the most effective, highest quality and value care so that they can live the best life that they can. And that's what's important. People need to be offered all of the choices that they should be offered. We want to make sure they have access. We want to make sure that it's covered by whatever type of insurance that they have. And we want them to be able to, patients also to be able to advocate for themselves. So it's not only important to educate the clinicians, which is NCCN's role to set these guidelines and make sure that they're being used throughout all of cancer care. But then the NCCN Foundation that I run has a focus on patients and making sure that this information is available to patients in a format they could actually understand.
Well, that's a magic sauce there. How can the average human being understand academia? What is the babble fish that you guys use to bring that down to a general person understanding it? Mm-hmm. It's like an art and a science.
That's what I always say. We have a team of fabulous professionals at NCCN putting together the guidelines, but also adapting them to, if the average person tries to read the clinical practice guideline, I've heard a lot of people say they might understand every 3 words, every 4 words. So it's hard for them to understand because they don't have the clinical background to pin it to.
Right.
But as a patient or a family member or somebody that cares about somebody with cancer, they need to know that information. Nobody wants to have to learn what chemotherapy is.
Right.
Nobody wants to have to learn.
Well, it's not like you're shopping for a fridge and you do your research in advance. Like no one's like, can't wait to get on that cancer drug. Like that's just
let me read
happen.
up.
Yeah.
It's not, it's not what anybody expects to happen.
Right.
So when you're thrown into the deer in the headlights, you've just been diagnosed or a loved one's been diagnosed, you don't know what to do, you don't know what to say, you don't even necessarily hear what's going on after that because all you heard was you have cancer.
Yep. Charlie Brown teacher.
Absolutely. Yeah. And so your care team is trying to communicate to you some of the things that you need to know quickly. It's a lot of information. You're thrown in, and yet you just have to try to navigate through all of this overwhelming, complex information. And with the positive trend of there being a lot of different treatment options available depending on what suits an individual, that then also puts a burden on the patient to be part of the decision-making process on what treatment might be right for them.
And I'm sure there's, and I've seen this, with this the young adult show, and there's so much generationality differences in how the younger groups approach the doctors versus the way maybe traditional boomer geriatric, gerontologic communities, tend to just accept what is basically stated. I would love to do a Q&A or whatever. How many people have questioned the doctor or proactively said, I want a second opinion, versus who hasn't by age?
And you hear a lot of feedback that patients sometimes are afraid to question their physician or to say, I want to go for a second opinion.
Right.
So it definitely is generational.
Yeah.
But the fact that we do need to be our own advocate and to understand some of this complex information.
Or have someone to help you learn what that means.
Absolutely.
Not everyone has the sort of the congenital predilection to have that personality trait.
Yep. So to
That
have
was
an
a lot
advocate.
of syllables. Sorry about that.
So it's really important that this information exists, and it's really important that this information exists in a friendly way.
Yeah.
That people can read and understand and digest on their own time, not in the 15-20 minutes you have in the oncologist's office where they're telling you a lot of information that you might not remember. The foundation, the NCCN's foundation, provides a patient-friendly version of this clinical information.
Layperson
Yes. Format, trying to bring it down as easy to understand as possible. But the art form in this is, like you said earlier, is that if you make it too simple, you lose the content, you lose the meaning. So the balance is, we want to make sure patients have all the information they need to make educated decisions about their care.
That's what it's about.
But
The right to know your choices.
absolutely. And making it understandable enough that the average person can get through it and understand it. And in a time when patients and families feel like they've lost all control because cancer's taken over, and the hospital system and the care team, is kind of leading the way, it's important to have some semblance of control over something that's
A
going on.
handrail,
Yeah,
a guide rail, something
that's
like
a great
that.
way to say it.
So our crowd likes progress. We like to talk about things that matter. We've been yelling and screaming for 12 years about young adult cancer. And again, behind the scenes, the sleuths over here came out with the guidelines for adolescents and young adults. This is progress, and you never heard of it. And we're here to tell you, this is exciting stuff. We're being paid attention to, and it's finally a narrative, and it matters to the industry. And tell us the origin story.
Absolutely. Well, there's a clinical practice guideline for adolescent and young adults on our clinical side to help instruct oncologists and care teams on the best way to treat adolescents and young adults with cancer.
Well, when did that start? Again, we go back to 2006 with the Livestrong Alliance and the LEA Progress Review Group and the documentation from the CDC about outcomes. It trickled up.
Absolutely. The experts at our member institutions recognize the need for recommendations for adolescent and young adults with cancer. And that importance then brought on the need for a clinical practice guideline to follow when caring for AYA patients.
Ninjas. We like progress. We like to hear that the needle is moving on our behalf to restore what I call dignity, equity, parity, so that we are all able to make decisions on our terms that matter to us, age appropriate.
Absolutely.
This might be it's an age appropriate guideline. That's a big deal.
Yes.
Really big deal. So again, in terms of, I guess what keeps me up at night is guidelines are fantastic. You're building this, or you already built this extraordinary community of professionals in oncology that are coming together to build these standards by which everyone technically should, but they don't always do. And we talk about how the community cancer settings are vastly different than the comprehensive cancer settings out there. And one of the flagship tentpoles of young adult cancer, and it's in here, is sort of your right to family planning.
Yes.
Being made aware of infertility risk, decision making on banking sperm, oocyte preservation.
Yes.
How is that narrative? Because now that it's young adult,
Yeah.
that issue of infertility really only matters to young adults because they're the ones in their fertile years. Where have you seen uptick or response to that specificity in here?
What's nice about the NCCN Foundation is that we do collaborate with organizations such as Stupid Cancer. And so, we have this vast network of organizations that know and love what we do and really love to share the guidelines. And it's something I hear over and over and over from so many different organizations, not just AYA-focused organizations, but just in general. I hear all the time how important fertility preservation is, how it's not happening as it should, and that it's not being talked about enough. So it's important to us to have that information in this, this book for AYA. AOA is diagnosed with cancer, but also some of our other patient guidelines too. So
Sure.
cancer specific. So it is mentioned in many of our patient guidelines. You know, care, depending on where you go, can vary, and not everybody can get to an academic center. Transportation, costs. There's a lot of reasons why many people are comfortable going to their local centers for care,
Right.
which, you know, everybody should be following the NCCN guidelines, and they do in the community level too. But patients, I always say, you know, advocate for yourself. If you understand what the NCCN guideline says about what care you should be offered, advocate for yourself.
Right.
You can find the NCCN guidelines through the NCCN guidelines for patients. You can take that with you when you're being seen and
Right.
advocate
Versus a
for,
stack of papers from the internet.
Yeah, Dr. Google.
Don't do Dr. Google.
No, it doesn't work well. This is what I always say is, you know, when my family, my kids, my parents, anybody's diagnosed with an illness in my family, for me, the first thing I think of is who's the best physician? What is the best center that I could go to have this treated? 'Cause
Right.
this is my loved one, and I want the best for them. You can't always do that. I'm
Right.
not going to fly to California and
Yeah.
you know, go to a specialist there. I just don't have the funds to do that. So what the NCCN guidelines provide for you is the dream team of sub-specialists that only focus on your cancer, and they recommend what you should be offered through the guidelines. And so the patient guidelines deliver your dream team in the palm of your hand in a book.
In your neighborhood.
Yeah.
Yeah.
And you can take that to your physician, and your oncologist will know NCCN because they are following NCCN guidelines.
Wow.
And you can work with them. It allows the patient and the family to have a mirrored copy of the same playbook that the experts are using.
Without having to fly to X, Y,
Absolutely.
and Z and incur all these out-of-pocket costs.
Absolutely. And it's not just the treatment. It's screening, it's diagnosis, it's staging, it's treatment, it's
Well, survivorship
follow-up,
too, yeah.
survivorship, distress, side effect management. I mean,
Yep.
you name it. There are clinical guidelines for many,
I'll just
many
say the word
things.
again. Comprehensive.
Yeah, absolutely.
So there you go, folks. The sleeper agents of oncology, the National Comprehensive Cancer Network. Marcie Reeder, Executive Director. I'll tell you guys, like, you should know about this organization behind the scenes. They're doing really great work. We're proud to partner with them. And thank you for joining us here on the
Thanks
Stupid
for having
Cancer
me.
Show.
I appreciate it.
All right, guys. Thanks for a great episode, and we'll see you back here next time. Bye-bye.
Bye.
Hey guys, thanks for watching. Please subscribe to our show and click the bell to be notified whenever we post new content. Take care. See you next time. Bye-bye.